The murder rate against children increased by 22.6%. This is what members of parliament heard on Friday, when the South African Police Service had released the latest crime statistics for the period between October and the end of December last year. So attempted murder of children increased 30% year on year and 39.2% quarter on quarter. So the data categorises children between the ages of 0 to 17 years old. Let's chat a bit about this now. Joining us to discuss a bit is Dr. Shaheda Omar, who is with the Teddy Bear Clinic. She's a director there. Dr. Omar, thank you very much for joining us indeed. Always a pleasure to have you here on the program. So these statistics sure give us, a general indication of what's happening. But is this anywhere near the full picture, as currently there's no statistics for missing children?
So, Griselda, this is most disturbing. It's horrific. It's soul-destroying. It's heart-wrenching. More than 2 decades ago, we talked about baby Tsepang, baby Samantha, and we find that there are more and more children with more names and numbers, like Zandi, the 5-year-old from Orange Farm. Then we've got Tesle van Wyk, the ex-parolee that raped and murdered them. And we know that 1,000 children on an annual basis are victims of violence, entrenched murders, and 3 children on a daily basis. So the statistics that we are seeing is not an accurate reflection. There are many cases that are unaccounted for, many cases that have not been investigated thoroughly, and no prosecution as a result of that. So the systems are failing our children, and that is alarming, that people are not stepping up and ensuring the safety and protection of children.
Access is certainly one of the major issues. I mean, what then in a place like rural areas where I understand some of the missing children are not even reported, so for a number of reasons. But what happens in instances like that where there are challenges, including access?
Well, I think that you are absolutely correct. In the rural areas, the resources are few and far between. However, SABC is supposed to be decentralized in every province and every area. But again, I want to speak to the fact that you get pockets of excellence, and we don't find that in the rural areas they are sufficiently equipped or trained in terms of the FCS unit officers, and the responses are not always swift, prompt. So, of course, more budgets and allocation of resources need to come. And who is responsible for that? Government. That, they need to address these things on the ground. We are treating the symptoms. We are not getting to the root of the problem. This is a systemic issue, and everybody needs to work together. Every government department, from health, justice, law enforcement, social development. This is co-responsibilities here, and there should be collaboration, coordination, and integration of services.
I want to bring in Bianca Van Aswegen. Bianca, thank you very much for joining us as well. You're the National Coordinator for Missing Children South Africa. I hope you're with us. I hope you were able to catch the discussion at the beginning. I mean, what impact has COVID-19 had on the figures that we're seeing? Because even children seem to be more online now.
Good afternoon. Yes, definitely. Especially during COVID, we've seen an increase in human trafficking, for instance, where it's made it easier for these syndicates to get access to children and people being vulnerable, with false job advertisements, extortion cases that are happening. And each year we do see an increase in cases of children going missing, children being murdered. And it's absolutely, yes, the world has seen a pandemic these last 2 years facing COVID. But children going missing, children being murdered has been a pandemic for many years in South Africa, and definitely something needs to be done, and urgently too.
I mean, how can we address these systemic flaws? Dr. Omar talks about systemic flaws that need to be addressed. What can be done to safeguard children? Because as you've said before in a conversation that we had earlier, that even the US State Department has classified South Africa as a trafficking hub. Bianca, can you still hear us? All right, we seem to be having challenges with that connection. I'm hoping that Dr. Omar can hear me. Dr. Omar, you spoke about these systemic flaws. What can be done to address these flaws? What can we do to safeguard children? A bit earlier on when I spoke to Bianca, she'd indicated that the US State Department had also classified South Africa as a trafficking hub.
Indeed, I think if we just look at the way, protection and preventative measures are put in place are not adequate. If we just look at the responses, when a child is missing and they report it missing to the law enforcement agencies, often people are not treated fairly, shabbily treated by law enforcement officers, or they actually told to return after a while. So, we need to actually ensure that there's proper training, skill and experienced people who are also monitored in terms of their performance, because a lot of people out there actually don't want to report crime or violence against children because of the kind of inadequate responses that they are received. In fact, people suffer secondary victimization and trauma. But we also need more visibility, police visibility, and of course to treat every case as it is. Serious and immediate and swift responses should be meted out.
Dr. Omar, are we failing our children? I know that you alluded to that just a bit earlier on. Are we failing our children? Because the issue of violence against, I would say, women and, some of the most vulnerable, including children, when we look at these staggering figures, nothing seems to change. In fact, this is an increase from what we heard the last time. Am I correct?
Indeed, I think if we just look at the whole pattern, it's just perpetuating itself. And what Bianca said about COVID-19, I just want to add to that abuse and violation of children, crimes against children, was actually prevalent long before COVID-19. COVID-19 has magnified the problem and has unveiled the many traumas that people have been subjected to. Either their children are gone and they haven't found their children. Many children have died. There's been increased kidnappings, as Bianca spoke about, extortion. So the violence against children continues to escalate. And as I said, we're addressing the symptoms. Every time there's an incident, everybody responds in shock and horror. But that's where it is. That's where it ends, because nothing is done. No concerted efforts are put into place that children could be safe and protected.
Bianca, I understand that you're back with us again. Thank you very much from the National Coordinator for Missing Children South Africa. Bianca, why are we failing our children? Why are we not able to address some of these issues that are facing our most vulnerable? All right, Bianca, are you able to hear me? Good afternoon to you. All right, apologies. We seem to be missing Bianca.
Apologies for that.
All right, please continue. Sorry about that.
All right, sorry, I missed the question on before we lost connection.
All right, Bianca was saying, why are we failing our children? Because according to Dr. Omar and what she shared with us, what we continue to see is an increase in the number of attacks on some of our most vulnerable, including our children, as per the statistics that were released by the South African Police Service. Why are we failing? What needs to change?
I think it's each and every citizen in South Africa's responsibility to stand up, fight for our children and keep our children safe. It's not just that of the police. It's not just that of government. It's not just, the health department. It's each and every citizen of South Africa. Our children at schools, our schools need to be educated on child safety. The parents have the biggest responsibility when it comes to child safety, and especially the safety of what they're busy with online, for instance. So it's very important that, like Dr. Omar said earlier, it's a collaboration of everybody together to stand up and fight against this, to keep our children safe. These figures cannot go on as they are going on. It's a yearly increase and it's absolutely devastating.
Why don't we have an accurate account of the number of missing children? What we have is the statistics, But I'm sure you would agree with Dr. Omar that while we may have these statistics of children who have been murdered, we don't have statistics of missing children. And subsequently then, that means we don't have the full picture of what is taking place.
Unfortunately not, and that is quite the scary part of it. As Dr. Omar mentioned earlier on, stats actually just gives a kind of an indication of what we are facing with. But there's many cases that do not get reported, rural areas that are unable to get to a police station to report, people being uneducated in what to do when a child goes missing. This all plays a role in the fact of the proper figures of how many children are actually going missing in our country. Human trafficking has escalated, especially during COVID. We've actually been declared as a human trafficking hub by the Department of the US state. So that is very concerning. I mean, those children that are on the streets being taken for human trafficking, who is going to report them as missing? So it really is the figures that we are seeing, an increase yearly at our organization is really scary. But unfortunately, the numbers that is the proper statistics about children going missing is unavailable.
To you both, thank you very much indeed for joining us here on the program. Unfortunately, we ran out of time. Bianca Van Aswegen, who's the National Coordinator for Missing Children in South Africa, and Dr. Shaheda Omar, who is with the Teddy Bear Clinic. She's the director there. Thank you very much indeed to you both.